Kia ora koutou katoa, good afternoon everybody. After a very quiet week on the COVID response front, and because everyone's currently talking about the weather, I'm particularly pleased to report today that the first 360 doses of the Pfizer vaccine were delivered to the Chatham Islands at 7:30 p.m. yesterday in somewhat stormy weather conditions. The Chatham Islands is home to one of New Zealand's most isolated communities. If COVID-19 was to make it there, the community could be severely compromised, placing significant pressure on the Canterbury DHB. They've identified the islands as a priority group, and people can expect to get their vaccinations on the Chatham Islands over the next few weeks. Around 560 residents on the Chatham and Pitt Islands will be eligible to get their first doses of the vaccine. They'll be storing them very carefully as they get their campaign underway over there. As of midnight last night, we have delivered 1,149,608 doses of the vaccine across New Zealand. That's an increase of more than 130,000 doses on last week. Within that, just over 705,000 New Zealanders have now received their first dose, and more than 444,000 have received their second dose, meaning they are fully vaccinated. Of those, 206,406 are in Group 3, or have had their first dose from Group 3, and 91,477 in Group 3 have had their second dose. Of the information going up on the Ministry of Health website right about now, we've added a bit of additional information to the dashboard this week. You'll see there's a bar chart indicating vaccinations by group, by week, and a table that shows cumulative vaccinations for each of our groups. Overall, we continue to track ahead of plan. It's about 8% ahead of plan, mindful that we have some tight delivery schedules that we're working for, and we're managing supply very closely. We've been clear for some time now that we could enter a period of tight supply relative to demand through June and early July. That's very much the position that we are in at the moment, as I outlined yesterday. But just to give you a little bit more detail on that, ahead of the large deliveries that we expect to receive from mid-July onwards, we're expecting 1 million doses to be delivered across July. We are finally calibrating the supply across our 20 district health boards. By the time our weekly delivery of Pfizer arrives next week, we'll have less than a day's worth of vaccine left in our freezers. That is a deliberate decision. We've taken the decision that we would rather have vaccines in people's arms than waiting in fridges. Transport management processes are now much more streamlined than they were in the beginning, meaning that we get underway dispatching vaccines to deliver to DHBs within a few hours. So vials can land by international air freight in the early hours of the morning and be on the road by mid-morning. Stock levels at each DHB are being monitored very closely, and we're making sure that the deliveries that we give them over this next few days is very closely aligned to their bookings, so that the stock is getting to the right places and to match that demand. In terms of Group 3, district health boards are continuing to contact everybody in Group 3 to let them know that they will be receiving an invitation by the end of July. By the 23rd of July, everybody who is enrolled with a GP should have received an invitation to book their vaccine. Group 3 vaccinations do continue to increase. In terms of the booking system, district health boards are in the final stages of transferring their existing booking data into the online system, Book My Vaccine. Book My Vaccine will be used to book appointments when our Group 4 rollout begins. So therefore it will be available to the wider public to see from the end of July, around the 28th of July. I understand some of the people in the room here saw a demonstration of that last Friday. It is a huge and complex system. Those going online today looking for it won't see it. It's only visible to those who are being invited at this point. But to successfully migrate all of the information into the system, the IT teams have been working well into the night, overnight in some cases. That work is unseen. Many people won't even know that it happens, but I do want to acknowledge those teams who are working incredibly hard and send a shout out to them to thank them for the work that they've been doing. We have had questions in the last few days on other vaccine candidates and the Janssen vaccine in particular. It is the next likely vaccine to be approved in New Zealand. The Medicines Assessment Advisory Committee met earlier this month to discuss their application, Janssen's application for their COVID-19 vaccine, and they're in the final stages of making a decision on whether to grant provisional approval for the Janssen vaccine to be used in New Zealand. And we should be able to provide a more comprehensive update on that next week. They're in the final stages of that decision-making process. So in closing, we started today by focusing on our vaccine numbers, but before I hand over to the Director General for his update, I do want to acknowledge a couple of other significant things. The ongoing intensity required around our COVID-19 responses reflected in the 10,097 tests reported today. So a big thank you to those involved in testing across the country, and also a big thank you to those who have been coming forward to get tested. It's worth remembering that we have processed 2,288,000 tests so far during this pandemic. Having been the recipient of some of those tests, I do want to acknowledge particularly those who are being very frequently tested for COVID-19. I also want to acknowledge that we're about to hit another significant milestone in our managed isolation facilities. 150,000 New Zealanders will have passed through our managed isolation facilities within the next few days since the pandemic began, and we've seen very few incidents of COVID-19 passing out into the community. It has been an incredibly successful system, and that is the result of the hard work and dedication of those who are working at our border to make sure that where COVID-19 does land in New Zealand, it stays at the border and doesn't make it out into the community. So to all those frontline workers, wherever they are, whether they're at the border or in our MIQ, I think the entire country owes them a great big thank you for their work. I now hand over to the Director General.
Thank you, Minister. Kia ora koutou katoa. So pleased to report today, as the Minister's mentioned, no community cases, and we have one new case of COVID-19 and a recent returnee in our managed isolation facility. All our other numbers will be reported through today's statement from the Ministry. With regards to the situation in Australia, members of the Ministry's Public Health team are continuing to closely monitor the situation there. Currently, more than 12 million Australians, close to half the population, are covered by lockdown-type restrictions there. And just to summarise what the situation is regarding quarantine-free travel and what is intended to happen over coming days, currently quarantine-free travel flights from all of Australia are paused until Sunday the 4th of July at 11:59 p.m. After that time, quarantine-free travel flights from Melbourne, Canberra, Adelaide and Hobart will resume unless there are developments in the interim that change the risk profile for any of those places. And all passengers travelling from those places must present evidence of a negative pre-departure test taken within 72 hours of boarding, and that test must be a PCR test. The quarantine-free travel pause remains in place for New South Wales, Queensland, Western Australia and Northern Territories until 11:59 p.m. Tuesday the 6th of July, and a review of the pause will occur on Monday the 5th of July, and officials are currently looking at options, as the Minister mentioned yesterday, to help return people home to New Zealand from pause-affected states or territories if the pause is extended there beyond 11:59 on Tuesday the 6th. A reminder, though, to anyone, wherever they are in Australia, that if you were at a location of interest, that at the time specified, you are not able to travel to New Zealand from anywhere in Australia for 14 days after that exposure event. Regarding pre-departure testing, travellers wanting to think about future travel back from Australia can look on the Unite Against COVID website to just get clarity around what is required, and the local health officials, wherever you are in Australia, will have information on where you can be tested. That testing is done privately, and the cost is generally between $120 and $180 per test. On border worker vaccinations, just a quick update on vaccination among that workforce, particularly those who don't work in managed isolation facilities. The latter group, of course, is required to be fully vaccinated. There are more than 200 businesses operating at a range of borders around the country, both airports and ports. This includes everyone from airport shop workers to truck drivers who are attending ports. You can appreciate also there is turnover of staff and that many of these people are only at these sites fleetingly as part of their work. The latest figures we have show that 83% of workers recorded as active in the border worker testing register have received their second dose of the vaccine, so they are considered fully vaccinated, while another 3% have received at least their first dose. The remaining 14% have either not yet been vaccinated, are exempt, or had not been able to be matched to their vaccination record. That's a small number. But only some of these workers, of course, currently fall under the current vaccine order that requires them to be vaccinated. However, as the Minister mentioned yesterday, there has been work on the next iteration of that border order, and it will be coming shortly. It will extend the mandatory requirement for vaccination to a much bigger group of people working at the border. The Ministry, right from the start, has worked closely with DHBs and our colleagues across government and in the private sector around that vaccine rollout to this group of workers. That's included providing information in multiple languages, holding face-to-face sessions with workers where they have had the opportunity to ask questions of health experts, and I myself have done some of those over Zoom. I'm confident that these workers have access to good information, and with between 150 and 200 vaccination sites open most days around the motu, they have had and continue to have good access to vaccination. Thank you, Minister.
You use the language managing supply and tight supply, but we're running out of vaccines. Is that acceptable?
Look, we're getting vaccines in as fast as we can. So we were very clear back in January when we made the decision to switch to a Pfizer campaign rather than using multiple different vaccines at that time, that would mean we would be waiting until the second half of the year to get the bulk of our vaccine deliveries in. Pfizer have been very good to work with in terms of when they indicate that they're going to deliver a quantity at a given time, they meet that delivery schedule, and so we're really appreciative of that. But we did make that decision to try and calibrate our vaccine supplies in the first half of the year so that we weren't leaving much left in the freezer while we stood prepared for the big doses to arrive.
Why not just say we're running out of vaccines? We just have to prepare for that.
Well, we know we've got more vaccines coming. So, well, of course, but I mean, that's always going to be the case. The goal is not to have a whole lot sitting in the freezer for a prolonged period of time. It's to get it out as quickly as we can as it gets into the country.
What's the message going out to the
Well, I'll let you finish that, Jessica.
What's the hold-up with the Janssen vaccine? Why hasn't that got MedSafe approval yet?
Look, it's still just going through the final stages of the MedSafe approval process. Often with the approvals process, there's discussion between the company and MedSafe just around any wording that goes, it's a little the dotting the I's, crossing the T's part of the process. So that's the part of the process I believe that they are in at the moment.
New research out today shows we need about 97% of all New Zealanders, including children, to be vaccinated with Pfizer to protect against the Delta variant. Is herd immunity effectively impossible for New Zealand?
Look, I've always said, and this is it's a useful contribution to the discussion, and it is a model. It is, and so we should see that as a model. But I've always said really clearly, I'm not going to settle for any target less than everybody being offered the chance to get the vaccine, and everybody taking up the chance to be the vaccine, unless there's a really good reason not to, such as a medical reason not to. It is a safe vaccine. It is the way we can all keep each other safe. And so I'm not going to set a target that's anything below saying everyone should get it.
Minister,
realistically,
just wonder if I could make a couple of supplementary comments that speak to the question you've asked. First of all, the research, which is helpful, the modelling is helpful. What it does show is that to achieve immunity and protect New Zealanders just with the vaccine would require a very high level of coverage. However, there is considerable benefit even at lower rates of vaccination coverage, except that we have to have quite strong public health measures in place. The higher our vaccination rates, the less those additional measures have to be in place, and the less likely we are to have to use lockdown-type situations to manage outbreaks. The second comment I would make is that there is good emerging evidence that the Pfizer vaccine provides a high level of protection against the Delta variant, which is encouraging. And the third comment is, and this carries on from the comment I've just made, is that if you look in the United Kingdom, where they have got quite high rates of vaccination, full vaccination, and still quite high rates of infection, so the equivalent in New Zealand, or quite high numbers of infection, the equivalent in New Zealand of over 1,000 cases a day, virtually all the people being admitted to hospital or dying from COVID are unvaccinated. And virtually all the infections there now are Delta variant. So this shows the effectiveness of vaccination in protecting individuals and of helping prevent that wider population morbidity and mortality and impact on our health system.
Realistically, if we can't achieve herd immunity, do we just have to have these controls in New Zealand indefinitely?
Look, I think we've always said that there's not going to be some magical moment where all of the controls just suddenly disappear. Our reopening to the world is likely to be a progressive exercise. In terms of the higher levels of vaccination, yes, it will have an impact on the types of control measures that we use where we see outbreaks in the community. But there's still a lot of water to flow under the bridge yet. And of course, international vaccination rates play a really important role here in New Zealand as well. I've used the phrase, when nobody's safe until everybody's safe. Actually, the virus continues to spread around the rest of the world, and that's still a concern for us here in New Zealand. It still increases the risk to us here in New Zealand.
Do you think it's even possible that we could get to 97% vaccination rate?
Well, I think as the Director General has commented on, focusing only on herd immunity at this point isn't particularly helpful. There's a lot of aspects of this that we need to focus on, and the more New Zealanders who get vaccinated, the better we are going to be across a whole range of different measures.
Do you have numbers for each group? And do you have any new estimates for the actual group size as well? Because the estimates we have are from February or March.
Oh, you mean the numbers of people, the doses in each group? Yes, I do.
The Minister has probably got those numbers, yes. But as he said, we're actually showing now a new graph on the website that shows the number of vaccines given each week by group. So we will be making that available with a new a graph. And of course, as we move into the new deliveries arrive to assure our supply and the numbers go up each week, you will see the number of Group 3 people being vaccinated increasing considerably week on week, and then Group 4 as that comes online too.
So just quickly running through those in Group 1, 55,648 first dose, 50,917 second dose. Group 2, 389,721 first dose, 282,167 second dose. Group 3, 206,406 first dose, and 91,477 second dose. Group 4, 53,287 first dose, and 19,985 second dose.
Are you confident that in Group 2, those people in Group 2 who haven't had a dose yet or fully vaccinated, but they've been offered the vaccine, they just haven't had a chance to take it up yet?
Yes, they will have been, and obviously it's voluntary for Group 2, but we'd certainly encourage them to take up the ability to be vaccinated early.
On Janssen, would you consider at all using Janssen? Can you rule out using it as part of the mass vaccination rollout? Obviously, there's a lot of advantages to speed, and we're still expecting not to get the full shipments of Pfizer until October, and then it has to be rolled out. Janssen, we've got this big order, you pay money for it. MedSafe, we're probably going to approve it in a few weeks, is basically the understanding. A lot of people will probably be fine with this slightly lower protection, slightly higher rate of blood clots from Janssen. Could you consider using it as part of the vaccine rollout, people who want it?
Oh, look, we're continuing to go through the approvals process with it so that we have it there as an option. I wouldn't rule it in or out, though. But at the moment, Plan A is still to offer everybody the chance to get the Pfizer vaccine by the end of the year.
Do you mean people who actually need it because they're allergic to something in the Pfizer vaccine? Or are you actually thinking everyone could, someone could call up next month and say, I want Janssen right now, even if they're 25 and healthy?
Certainly, I think for a small group of people, it may well be an option if they can't have the Pfizer Pfizer vaccine. But in terms of making it available, we're not working on a choice-based campaign here. We are working on a Pfizer-based campaign. That's our intention to continue down that road. And actually, most other countries who are using multiple different vaccines don't provide people with a choice. They basically get told which vaccine they're going to have.
Does that mean that the Janssen vaccine will sit in storage in the eventuality that we need it?
Certainly, delivery schedules have not been confirmed with them yet. So there's there's multiple stages to this process. Approval's one big part of the stage. Decision to use and in the conditions in which we would use it is another stage, and then of course delivery, confirming a delivery schedule is another. So the approvals process is just one of those. But
yes, just 2 comments to follow up what the Minister said. First of all, our COVID vaccination technical advisory group has already looked at the circumstances and their advice to myself and through to Cabinet about when the Janssen vaccine might be used. And as the Minister said, there may be some people who, for whatever reason, can't receive the Pfizer vaccine, for whom it would be indicated. But their advice also, preliminary advice to me, is that given we have the Pfizer vaccine, which is a highly effective vaccine and has got a very good safety profile and showing very good effectiveness against the new variants, their advice would be to maintain our Pfizer-based program. The Janssen vaccine can be stored in the freezers for up to 2 years, and of course then there is the option either of using it here should it be indicated. For example, if there was a very big disruption to the supply of Pfizer, or indeed it could then be considered for donation to other countries, and that would be a separate decision, obviously, for Cabinet.
And the requirement for mandatory vaccination among board workers, who is that going to be extended to cover, and what proportion of the workforce will that then be?
Look, it will be a more significant part of the workforce than it is now. I've made some decisions about that. We're still in the process of working through all of the finer details of that. We're not far from being able to share that information, though. So I just can't share that today. Yes.
Your statements that we will run to a point where we have about 1 day's sort of doses left, is that based on us returning to that 100% of plan and not being at 107?
That's right. So that and DHB's, you'll see that whilst they've still the overall average is still maintained ahead of plan, they have been getting back closer to plan. Some of them there's still a little bit of over in there in the system, but look, I think it's finely balanced. It would be fair to say.
So we're still at 107% above plan, same as last week, down from the week before, but because of the nurses' strike. Do you really think we're going to get back down to 100 in 2 weeks' time?
Can I comment, Minister?
Yeah.
The reason we will, even at the end of our current supply and before that next big shipment comes, we will stay above 100% and probably land at around 106 and 107%, is because in many places the vaccinators have been able to get the 7 doses out of the 6 dose vials, and the plans were based, 100% of plan was based on 6 doses per vial. So we will maintain that, in a sense, delivering ahead of what the plan was right through to next week when the new drop arrives. Ben.
Can I jump on that? So I think you said on Monday that you had less than 30,000 doses left, and the supply was around 50,000 that you received this week. So am I right in thinking that you will only administer around 80,000 doses this week?
No, because that was what we hold. The people who are doing the vaccinations hold vaccines as well. So there's already vaccines out there in distribution, bearing in mind now that there's a much longer shelf life. So when we started this, we were working on the basis that we had to keep pumping it out for no more than 5 days. So now they can be stored for longer. So there is more vaccine out there sitting in freezers around the country, which is why the combination of that, I don't have that exact figure, but the combination of that number plus what we've got in store is what's going to get us through to next Tuesday.
Do you expect the similar amount of vaccines to be administered this week as last week, so around 140,000?
Yes, it might, yes.
And obviously that crunch point that arrives on Tuesday, but when are we out of the woods? When do we have that very big, when's that first very big
Expecting around, give or take, 150,000 to arrive next week. So that's obviously more than we have been doing on a weekly basis at this point. So that helps to start us, build up a little bit more of a buffer there. And then the following week, hopefully we'll be able to build up a little bit more of a buffer again. And then from mid-month onwards, we start getting bigger deliveries, which will mean that we then start to ramp up again. Well, as I've indicated, we're going to get 1 million doses over the month of July. Jessica, I'll come back to you.
Can we get a breakdown of the Māori vaccination rates, and how concerned are you about those numbers?
So it sits at about 10% overall at the moment. I think 10% of the first doses have gone to Māori and about 9% second doses. So that is below the population for Māori proportionately. I think if you look across, particularly Group 2, which is our biggest group so far, our health workforce, for example, we know, unfortunately, Māori are disproportionately underrepresented in our health workforce. That's something that I think as a country we need to focus on. We need to deal with that. That's not something vaccination's going to deal with. But we do need to see those numbers increasing for Māori, and that will certainly be a focus as we get into Groups 3 and 4.
The percentage rate, how concerned are you about that?
Look, I think it does highlight that as we get into Groups 3 and 4, we're going to need to really focus there on our equity challenges, making sure that for Māori particularly, but also for Pacific communities and for lower socioeconomic areas, that we're making sure we're getting good population coverage there and in line with their share of the population, if you like. I'm looking at the DHB by DHB numbers. So if you look at Northland, Tairāwhiti, Auckland, high concentrations of Māori, they're doing slightly better, which is reassuring. But that doesn't mean there's any room for complacency. We have to do better in that regard.
To clarify, on extending the mandatory vaccination border order, so it could be that sort of all frontline border workers, whether they're in public or private hiring, will have to get vaccinated.
Look, we'll have more detail on that soon, but certainly the vast majority of people who need to be tested because they're at more risk are likely to end up needing to be vaccinated.
And have you considered the potential negative knock-on effects of that, of people moving out of that and sort of there potentially being skills shortages because of people not wanting to get vaccinated, so then leaving?
Absolutely, and that's one of the things that we worked through with industry. What we have found, and I don't want to name and shame any particular groups here, so I'll speak in generalisations. But we've found that where we've discovered pockets of hesitancy amongst that workforce, and we've worked more intensively with those workers to make sure they're getting good impartial information. So it's often been sitting them down with a medical professional for 10, 15 minutes to actually talk through the ins and outs of it, what their reservations may be. We generally found that sort of 90+% of them then say, oh, well, let's get on with it and let's have this vaccine. So, yeah.
Have you considered sort of extending the groups eligible? So, for example, at the ports, sort of make more people eligible at the ports, so people who they share their lunchroom breaks with, they have more of their peers who are vaccinated to sort of further reassure people.
We'll get more options in that space as we move into broader groups of the population being vaccinated.
Yeah. Data on genomic testing on recent cases detected at the border, and how many of those cases have had the Delta variant?
I don't have the latest tally, but
we do have those data, and we get a report every week from ESR, so I'm happy to provide that information.
Is it largely the Delta variant?
That's off the top of my head, no, but we can give the proportions of which variants we're finding at the border.
That's just because that kind of reflects the new model from TPM that Amelia was talking about earlier. The PM had started the year talking about the need to transition from the border to a kind of personal armor around each other. And that language was really based off of the sort of original COVID. Does the prevalence of the Delta variant overseas make that kind of, I guess, language impossible going forward?
I'm not really sure what your question was there. Sorry?
Well, I guess, has the Delta variant changed your plans?
No. I mean, ultimately, our goal is still to get as many people vaccinated as possible. It is still to keep border protections in place to make sure that we're not allowing COVID-19 any quarter in New Zealand, and to work really quickly to stamp out any incursions that may come up. That's still the broad plan, and we're still sticking to that. Now, Derek, I'm worried your blood flow in your arm is decreasing. So,
do you have any update? A few weeks ago, you put out a call for the household border workers to come forward and get vaccinated. Do you have any update on how that's going And from the numbers you said earlier, there seems to be at least 100,000 people in Group 1 now. That's obviously a lot more than was first anticipated, although I know we don't actually know what the denominator there is.
We don't know what the denominator there is. No, I think, I think you can't add the first and second dose together. So it's 55,000 people overall, 55,600 people overall who have had at least one dose. The second doses generally have had a first dose as well. So that's the total number at this point.
Just like we know that, I think you said before, Dr. Bloomfield, that there's at least 27,000 border workers in the system who've been vaccinated, or roughly thereabouts. So that would indicate that only about 27,000 household members of those workers are actually vaccinated as well. Is that about right? As
I've indicated before, some of those household members may have been vaccinated but may not count under Group 1, so they might have been recorded under Group 2 or 3. If a border worker's living with a nurse, for example, the nurse might be counted under Group 2. So it's not perfect data. But
just in the last week, for example, so it is going up week on week. So in the last 7 days, 386 people in that household group so Group 1B we call it, 386 had a first dose and 611 a second dose. So it's still increasing, and that is people in that group who are identified as being household members of border workers.
Joe, to get vaccinated for that group. So I mean, is there anything else we can do there, or does it just seem like this?
We'll keep doing everything we're doing. I mean, it's providing really good information and access to the vaccine. And as I say, between 150 and 200 sites are open most days at the moment. From mid-July, that will scale up, and through July and August be up to 800 sites around the country. So there will be lots of opportunities for those people and others to be vaccinated.
Joe.
Just on the postcode lottery nature of the vaccinations, unsurprisingly, I'll use Taranaki as an example again. But the over 65s group, there's still no vaccinations happening there, and it's not just that DHB, there's quite a few. You talked some weeks ago about the fact that there were multiple reasons, resources, etc., and that it was for the DHB to do that. But is any pressure actually going on from a government or a Ministry of Health level, or as far as you're concerned, is it just a case of, well, if everyone gets vaccinated by the end of the year, it's fine?
Look, there will be unders and overs between now and the end of the year, absolutely, and we want people to be vaccinated by the end of the year. But we do want people to be vaccinated broadly in line with the sequencing framework that we have set out. I accept that there will be some unders and overs in that. So I just mentioned the Chatham Islands at the beginning, for example. Doesn't make sense to send over just enough vaccines to do, a few hundred of them when actually it makes sense to do all of them at the same time. So there will be some variation in that. In terms of those district health boards that are slower to start Group 3 or slower to get bigger numbers in Group 3, all have started Group 3. We have been really clear with them that they need to let people know by the end of July, well, they need to let people know as soon as possible that they will get an invitation by the end of July to have their opportunity to get into the vaccine program.
You said in the past that you were going to have some, I think they were called vaccine champions, and they were basically people that would be going out into the community and demonstrating that the vaccine was safe. Where is Cabinet or the government sitting now as to A, who those people will be, and B, when they'll be revealed?
Well, look, you will have already seen examples of this, of high-profile, public personalities going and getting their vaccinations, whether it's the Governor-General, the political leaders, Kaumatua have been playing a lead role here, church ministers, some of our sports people. I saw the coverage of Dame Valerie getting her vaccination ahead of the Olympics and doing that live on camera, which I know only too well how that feels. And so you will see more of that, and particularly as we get into those bigger population groups. What we've tried to do, though, is make sure that we're arranging those photo opportunities, for want of a better term, broadly in line with when people fitting that description will be able to get their vaccination as well. Sorry?
So for the Australian traveller on the weekend, were there any issues with contact tracing Australian tourists in Wellington? And has Cabinet considered any additional measures for Australian tourists who are going to come to New Zealand once the pause opens, like compulsory COVID tracing app on their phone?
The feedback I've had so far is that Australians coming to New Zealand do tend to be pretty active in their use of the QR code system, the COVID Tracer app system, and that the contact tracers haven't had any difficulty in that regard. Bearing in mind that in this one case, or two really, if you count the person's partner, they were very diligent in keeping good records of where they've been, and that definitely helped our contact tracing teams. So not looking at anything specific there, we are of course looking at that broader issue around how do we provide more accurate information faster to our contact tracing teams. We'll have more on that, and that's particularly around the COVID Tracer app, but we'll have more on that in due course. But in the meantime, my message to all Kiwis is it is one of the best things you can do to keep COVID out of the community, is to keep good records of where you've been. So for our elderly community who don't want to use the QR code system, if they're keeping some kind of record, we've got little booklets available where they can use those as a record instead. Please do that. It really does make a difference for our contact tracers.
2,600 contacts. There are still 83 that are being contact traced. Why is it taking so long to get to those 80 odd people?
I think I didn't bring that breakdown with me today, but my understanding was that some of them are not yet due. So there's a small group, I think, who are not yet due. There's actually quite a small number that are being chased because they have an overdue test. So I don't know whether the Director General has the daily breakdown.
83 that listed as chasing for contact tracing purposes.
Yes, we're just chasing to either match the test if they've had one, or to just confirm that they have had a test. If not, we arrange for them to be tested. But we are up over 96% of tests back, all negative.
How concerning is it with those 83 people? Because that sounds like a lot.
In the scheme of things, as we talked about yesterday, given we were following up over 2,600 people, not concerning, because we haven't seen any other signals from those other results we've had, and these people will be followed up and chased up.
It's worth recalling here that we've cast the net far wider than we have for any other COVID-19 case we've ever dealt with. The Verrill report, which set out the gold standard for contact tracing, suggested that you might have sort of 20 to 30 contacts per case. We're talking about 2,600 for this one case. So the system has performed remarkably well in that environment. Ben, come back to you. We'll come back to Ben and then Amelia.
Yeah. If we cast our minds back to the Papatoetoe High School, for example, it was the very people who didn't get traced who ended up having it, and that presented a whole slew of problems. So, how do we keep running into the instances where we can't get in contact with all of these people, and do we need to be sending out those mobile testing sites sooner?
If I take the first part of your question first, I think there was a difference in Papatoetoe in that we were dealing with spread of COVID-19, we were dealing with active cases. Here we were dealing with one person who's subsequently left. So there is a bit of a difference there, and in the context of 2,500 people traced and testing negative, that gives us some reassurance that the likelihood of those few remaining people being positive is very low. In terms of that better contact information, though, that is an issue that we keep under review all of the time. We get good information at the border of people coming into the country. The very mere act of signing up for the COVID Tracer app and sharing your contact details helps us enormously, because it means our contact tracing teams have a current phone number for you and a current email address for you, for example. So just doing that one thing is actually a really important way of us being able to keep in touch with people. Using the QR code system, monitoring for the alert notifications when they come up as well. Please don't just swipe it off the screen and forget about it. If you're getting an alert notification, you're getting it for a reason. Please take the action that the alert notification asks you to take.
In comments, you said that you were about to land on 150,000 New Zealanders through MIQ. What's the data for international foreign nationalities going through MIQ?
I don't have that with me, but I can certainly get you the breakdown of where they've come from. Obviously,
nationality of those people, because you've obviously given exemptions to foreigners in lots of places.
So I'm not sure what the...
You've given exemptions to go through MIQ to non-New Zealanders.
Yes.
So I'm wondering, what's the data? How many Australians have went through? How many Canadian to be let through.
Yeah, I'm happy to give you get you a breakdown of the country of origin of all of those 150, if that's what you're asking for. Yes.
It's not where they come from, the nationalities.
Oh right, yeah, I see. Yeah, but we can certainly do that.
On the postcode lottery thing Joe was just talking about, obviously there are areas of the country where over 65s who are really keen to get a vaccine who can't have it, but it's pretty much unconvertible. There's also areas where clearly people are calling the number up during Group 4 and they're getting vaccinated. 53,000 now in Group 4 who've been vaccinated. Obviously some of them will be household contacts and stuff, and there'll be good reasons. But that's quite a high number, is it? 54,000 people is not a handful of people.
If you look at that as a proportion of the million odd doses that are being delivered, it's still reasonably small. As I've indicated before, I think there are a variety of reasons for that. One is where DHBs have been doing community by community vaccination for small communities, where it just makes sense to do that. That will be a contributing factor. There may also be a contributing factor where you've done there've been a whole family, for example, who have been vaccinated together, some of whom are in that higher risk category, and for convenience and for the purposes of getting them to have the vaccine, the family members may have been done at the same time. And then, of course, there was that small group of people who just got lucky, because when we were managing 5-day allocations at a time and doses were going to expire, we did say to teams, just vaccinate people if you've got vaccines that are about to expire. That's less of a problem now because of that longer shelf life that we've got out of the vaccine.
To anyone who's thinking, hey, I could just call this number up and get a vaccine tomorrow, even though I'm a 33-year-old who has no pre-existing conditions.
My message is please don't do that. Please, let's just work our way through the sequencing framework so that we're vaccinating those at the higher risk first, and then we will work our way through. Once we get into Group 4, it becomes a demand management issue, and we'll be working to manage to demand. But look, at this point, please just let those people, Groups 1, Groups 2 particularly, but then also into Group 3, please let them get their vaccinations first, because we've prioritised them for a reason.
Previously said,
Derek.
like, other countries are sort of rolling out faster than we are because they have more vaccines that they're using, and we've chosen to go with Pfizer. Is our decision to go with Pfizer, has that affected the timeline for MedSafe approval with any of the other ones that we had purchase agreements for?
No, it hasn't, because MedSafe is, first of all, the first point is MedSafe is reliant on the data being provided by the companies, and so there's no sense that those companies have been on a go slow because we've chosen Pfizer. The second comment here is that the deliveries from those other companies that produce the other vaccines, Janssen and AstraZeneca, were scheduled to come in from Q3, in my recollection anyway. The decision was made back in February when the offer came for the additional Pfizer vaccines that were over and above what we had pre-ordered, which we're coming to the end of those we had pre-ordered. In fact, we were able to bring some of the Q3 delivery forward into Q2. I think about 100,000 of those doses were brought forward. We knew then that the balance of our vaccine would arrive in the second half of the year, and we gave that advice and made that call because we felt a single vaccine program based on the Pfizer vaccine, which even then had a very good effectiveness and safety profile, and that's borne out. That was the way to go, and we'd sort of stand by that
Because
advice.
it means we could not have gone any faster if we decided to go with more vaccines as well, right?
The logistics around establishing the whole program around a single vaccine was much easier than the logistics, the training and everything around a program that was based on more than one vaccine. That doesn't mean if there is an indication to use a second vaccine, we won't be able to do that, but a single vaccine-based program was definitely logistically more simple.
I'm aware the bell is about to toll, so last question up the back.
I guess with New Zealand's vaccine rollout constrained by international suppliers, I mean, how satisfied are you with international rates of production? And do you think things like the WTO IP waiver could assist the New Zealand situation?
Well, look, I think the pharmaceutical companies that have got vaccines that have been approved, that have gone through all their trials, they're working very hard to ramp up supply as fast as they can. And so full credit to them. They're playing their part in the global efforts. Of course, it's a massive undertaking to vaccinate the globe. And as I've always said, and you'll always hear us talking about this here too, we want to see high vaccination rates around the whole world, not just here in New Zealand, because actually that's going to add a layer of protection to us here in New Zealand. We're not all going to be safe from COVID-19 until we are all safe from COVID-19. And we'll leave
What
it.
night will
IP waiver though. Like, I mean,
What was that? Oh, it could help.
What night will you finally sleep easy?
I think we might be a few more months of this to go. Look, COVID-19 throws up new challenges every day.
Is there a day though that you'll know for sure that the next shipment's arriving, or that there possibly will be delays?
Oh, look, I'll be up overnight watching Flight Tracker to make sure that it actually gets here. Thanks everybody. I think it's Tuesday morning, early Tuesday morning. So, thanks everybody.